Hi guys, my name is Dr. Mona Hardas and I'm a board certified OBGYN, a cosmetic gynecologist. I'm a trained, minimally invasive and a robotic surgeon. I'm an author and I'm also a social media educator. Today's topic is very interesting, something nobody talks about and nobody wants to talk about. It's a very personal issue for a lot of women and they suffer in silence. It's called vaginismus. Have you heard the term vaginismus? Vaginismus means there is pain during sex, but that is because of involuntary contractions of the muscles which are at the opening of the vagina. So the vaginal opening is covered with these muscles which are called perineal muscles, and these muscles in people who have vaginismus, they contract so tight that nothing can get in, nothing, even the thought of something, an object going inside the vagina, make them contract so bad. So it could be attempt at penetration at sex, or putting a tampon, or even a physical examination like a gynecological exam where we want to put a speculum. It's just impossible to put any object in the vagina. And it's common, we just don't know why this happens. There are a lot of theories about why vaginismus happens. The commonest cause is your past negative or bad experiences. Something happened. Maybe you tried to put in a tampon and it was very painful. Maybe you tried to have sex and that was painful. It could have been sexual abuse, childhood abuse, or some people have these negative thoughts. It's been told them over and over that sex is bad. So when they have these negative thoughts associated with sex and they look at sex as a bad thing, vaginismus can happen. Now, there could be some other reasons. For example, you had a vaginal delivery and say had an episiotomy or had a vaginal laceration which wasn't stitched properly, or it healed with a scar tissue, and so later when you had sex it was extremely painful. So that painful experience is perceived by your brain as a negative experience, and next time you try to have sex, the muscles of the vagina like I don't want that painful experience again, and they involuntarily contract. Sometimes recurrent infections like a yeast infection, bacterial infection, urinary tract infection can also cause a lot of inflammation and soreness in the vagina. So attempt at sex will cause pain. And again, once you have the painful experience, it may happen that you may get vaginismus later. Vaginal dryness. Vaginal dryness could be multiple reasons. Perimenopause, menopause, certain medications you have been taking which decreases the estrogen level, breastfeeding, postpartum phase of your life. All these times when there's a decreased amount of estrogen in your body leading to decreased vaginal secretions can cause vaginismus. So vaginismus, we divide it into two classes. One is called primary vaginismus and second one is called secondary vaginismus. So primary vaginismus is the condition when a woman never had sex. She, at the first attempt of sex, it was painful. So she never had a pain-free sex, I should say that. Never ever had it. or even an exam or insertion of tampon. There has been no penetration which was painless for this person. The secondary vaginismus is that woman was sexually active. It wasn't painful at that time, but something happened. She had this painful experience, and then her body started acting to avoid, like, I don't want this painful experience again, I don't want sex, and that's why those muscles started contracting involuntarily. So it could be primary or secondary, but the underlying causes, as most common cause, as I said earlier, and I want to say it again, is psychological. There was something, it might be like underneath, you might have like blocked that memory off, but there has to be some painful experience, something in the past which led to vaginismus. But it's treatable. It is treatable. So please go see a gynecologist. Talk to them. Tell them that this is happening, because it causes a lot of problems. A lot of time woman wants to have sex. She's not trying to avoid. She would be interested. She is interested in sex. But she just can't, because these muscles are contracting, and that can cause problem with her own self. She can get depressed. She can be self-conscious. She will have a problem in a relationship. The marriages can break because she's avoiding. She's not avoiding herself. It's her body avoiding the sex. So treatment is important. It's out there. Talk to the gynecologist. They will take your really detailed history. They need to know everything from childhood to now. Please, very open and honest. Tell them about it. Tell them about your past experiences. If there are any psychological problem, are you depressed? Are you on any medication? Are you in perimenopause, menopause? Have you had any chemo, radiation treatment, any surgeries? All the detailed history is very, very, very important. And then comes examination. Examination is the key, because we'll find out during the examination that, speculum examination is not possible. We're gonna examine the perineal muscles, see if they're getting into spasm. Is there any reason? Is there a painful scar there? Is there any septum or a hymen which is imperforate, or a microperforate which is causing pain? So there are so many things can be ruled out. And once we figure out what is the cause of vaginismus, then it's treated. Now, when I say treatment is there, yes, it's there, but it needs patience. It's gonna take a long time before you can get to the stage where sex is not painful. So there are combinations of the things we do. One of the commonest thing we do is we use physical therapy. The physical therapist is a pelvic physical therapist who's trained in this kind of a treatment. Not every physical therapist will do that. So when I say they're trained in the pelvic physical therapy, that means they're trained in doing a pelvic examination. They're gonna be able to feel the perineal muscles and relax them or stretch them so that they are not tight and causing pain, right? So the physical therapy helps. Sometimes, not all the time, but sometimes injecting Botox into those muscles to relax them helps. Again, has to be a right candidate. Using dilators makes a huge difference. So the dilators is usually a set of dilators of 4 or 5 different sizes. They start from a really small one, like a very small tampon, to a large one which will be the size of the penis. And then we teach you how to insert them without pain. You may take months before you can go from a smaller dilator to larger dilator, or even to start with the small dilator. Just the idea of inserting that may cause vaginismus in you. So it's a process. You'll get there, and we'll teach you all the way along, because we're gonna add psychotherapy, relaxation techniques, some relaxation exercises for relaxing those perineal muscles. You can do it at home. Your gynecologist will talk to you about that. And also couples therapy, something called desensitization therapy, where we can help you desensitize to this idea of pain. Fingering, the therapist can teach you or your husband or your partner how to do the fingering and how you will not be in pain. There are certain medications like local anesthetic agent or some local antidepressant medications which work on the nerves, which supply these muscles and will help in relaxing the muscles. So there are multiple ways of treating it. One treatment doesn't fit all, and one treatment is not enough for most of the people. Is the combination of the treatment, is the persistence on your part, and understanding by your partner. There are a lot of things associated. And of course, your relationship with your gynecologist, where you feel comfortable and free enough to talk about it and go through these stages. But please find a person, find a physician who's willing to help you, who you feel comfortable talking to and getting treatment, and then they will direct you in a right direction. Now, if you have any questions on this topic, please comment below. You are more than welcome to contact me on any of my social media channels. I have IG, you can DM me there. It's called GlamGyno. You can call my office, make an appointment, or you can email me as well. I'll link my email address down there. But I don't want you to suffer in silence. I want you to get the treatment and help so you can enjoy life.